This study aims to find a model that could forecast nurse staffing requirements during a new and future wave of COVID-19 pandemic in Texas. So the dataset that I use comes from the CDC, and machine learning models in R are going to be created using this dataset. In this methodology, we are going to have three main elements. One is data collection procedures, data population, and time series properties and mechanism. In data collection, as I mentioned, all the datasets are retrieved from the CDC website and they are in CVS format. So the main process in this stage is to format all the variables in such a way that they are going to be stackable in all the datasets, as well as formatting date variables to be able to carry on the analysis. In the data population, we can see that the original dataset had nearly 26 million observations, and for our study we made a subset only focus on the North Texas area, which is going to be a small subset, 2,300,000. That will be the final dataset we are going to use for my analysis. As far as the time series properties and mechanism, the model ARIMA is the best approach for the type of data I have, since it allows to describe data that is not stationary in various conditions, and the study is made in R, is going to be performed in R, since R is a graphics programming language that is a very powerful open source program, and it provides many packages and functions that can be used in algorithms to create solid programs for time series. The other component of our research is the findings, and this is going to be composed of three elements: analysis of data, results and research questions, and limitations. In the data analysis, we have two variables that are going to be the subject of our study. The first one is the target variable, in this case is total beds in 7 days summatory, and is the variable that gives us the amount of beds that a hospital has currently available or used. And we also have the variable collection week date, which this one is a variable of time, and those are the two types of variables time series requires to make any analysis. We're going to have a start date, so 2020 month 10/16, that's the format of the study, and the end date it will be 2022-02-04, which is February 4th, 2022. As part of our data analysis, we have a condition called stationarity, and that is that we determine the roots of the difference of the regression of our data to see if that data is stationary, meaning how variable that data is. Usually small p-values in the test Katowski-Phillips-Smith-Sin, which is KPSS. Having small values there indicates that the differencing is necessary, and in this case we can see that our test revealed not to be significant for the p-values of the type 1 and type 2 components. So the alternative hypothesis, that is, now we have two hypotheses in this. The null hypothesis says that the model is considered non stationary, and the alternative hypothesis says that the model is considered stationary. In this case, the null hypothesis is rejected, and we take the alternative hypothesis, which says that the model is considered stationary. Other parts of the analysis tell us that our data is behaving in a normal way. One of them is the autocorrelation forecast plot of the residuals, and in this case we want to see them exactly how they are displayed in this chart, with alternative disposition of the residuals according to the line 0, going up or down, and is in between the range of the limits. And then another indication is how normal the data can be, and this can be done by the normal QQ plot. And our data set has outliers in either end of the data, especially at the beginning, since we are missing some data. So we are going to see that most of the normal behavior is in the center, which is something that we really want for our analysis. In the section of results and research question, We have two business questions that are posed for this problem, for this analysis. One is how much time does a hospital have to allocate nurse practitioners from when case start to increase a new COVID variant to when a COVID related hospitalizations are significant. And the model I built gives a good helps a lot with this answer. We can feed data that we can feed the model with data to predict a target variable. And in my paper I'll talk about the example of having a big hospital. In this case I use the North Texas dataset as the main source of information for my model. And if we imagine that the North Texas area is a hospital and we tell the model to let me know when I'm going to be able to use 100,000 more beds of capacity in my hospital, feeding that information in the model is going to give me answers. For example, this is probably too small to see, but this point tells me when I am asking the model to let me know when those 100,000 beds are needed, and then it give me the answers on my question. In this case, it's telling me that I'm not going to have 100,000 patients in 1 week. I'm gonna actually release 100,000 patients from my hospital. That allows me to allocate the nurses that I had that were taking care of those 100,000 beds, which in this case is a little bit over 2,000 nurses in my staff, that are going to be free to do other tasks, which is a great output from this software. The limitations of this study are that the study only covers the nurse staffing requirements for hospitals. The data used in this analysis comes from the CDC. A subset of the North Texas data was used to create the time series analysis. And Texas did not report the hospitalization data concerning the beginning of the pandemic, which is not ideal for the time series analysis. Nonetheless, I did the analysis without inputting data. One element of my document is a discussion. There are 3 points that I want to stress in my discussion. One of them is that the nurse staff is the most affected profession by the COVID-19 pandemic, since nurses are in direct contact with patients that are infected by COVID. And as we saw in my document, nurse staff at the beginning of the pandemic were suffering from the lack of PPE, and also they were working long hours, which led to burnout. And while most of the other professions had the choice of working remotely or not being exposed directly to other individuals in the workplace, the nurse staff did not have the choice at all. They had to be in direct contact always with patients that are infected, and they had to treat other patients as well. Other point is that the Texas Department of State's Health Services did not report COVID hospitalizations at the beginning of the pandemic, which led to a lack of data in our data set. And I hope that in the future this type of situations are going to be documented. The last point is that COVID-19 is not over yet. As we saw in my document, it is a virus, so it's going to evolve and mutate in such a way that the current vaccines might not work anymore against this virus. So that gives room to possible new waves coming in the future. For conclusions, I can say that I developed a model that works with data from North Texas, but it could work with any data set that we can feed into the model, and it uses the time series with the ARIMA method. This program predicts hospitalizations more accurately. This program can predict hospitalization cases more accurately according to the data we feed into the program. And my vision for this project is to develop an application in R that is going to subset data from the CDC and narrow it to a hospital level, so we can know what the requirements for an hospital could be in case of a new COVID wave. COVID-19 is a virus that's going to keep changing, evolving, and mutating into new variants that could potentially pose a threat for our country like it did in 2020. And I hope that this project could help to predict the nurse staff requirements for the healthcare organizations. My name is Josefas. Thank you very much.